The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Good morning, everybody. This is Laura Gray, the Director of Education with Drug-Free Sports. Thank you for joining us for today's webinar, Mental Health in Collegiate Athletics, Identification and Treatment Recommendations. I'm going to quickly get started just by a really brief introduction of our two speakers today. Casey Oiness and Dr. Chris Carr are both sport and performance psychologists with St. Vincent Sports Performance in Indiana. We're thrilled to have them here. We do have both of their full bios available to you in the handout section of the GoToWebinar dashboard, so feel free to upload those and take those with you to review, and I'll also let them kind of introduce themselves on their own as well. A few housekeeping things for us today. We do have some continuing education credits available for certified athletic trainers. You will receive one Category A continuing education unit for attending today's live webinar event. Please make sure that you do stay tuned after the webinar to get going with our post-webinar survey, as we do need to collect that data in order to award you your continuing education certificate. You can email myself at lgray@drugfreesport.com with any questions about continuing education or today's webinar at your convenience. We'll also be holding all questions until the end of the webinar, and our speakers are going to make some time to take those from our attendees based on any questions. So feel free to enter them in the questions tab box for GoToWebinar as they come up, and we will review them and present them to our presenters at the end of the session. Again, I thank you for being here today, and we'll go ahead and pass it over to our presenters, Dr. Chris Carr and Dr. Casey Oiness.
Great, thank you, Laura. Good afternoon to everybody that's attending. We're hopeful today can be informative and give you some information that helps you regarding the psychological health care of your collegiate student athlete. That's our primary focus today, is talking about the college-age student athlete. Casey and I both work at St. Vincent Sports Performance, which is in Indianapolis, Indiana. We are the two sport and performance psychologists. We work in combination with team physicians. We have sports medicine, primary care physicians, athletic trainers, physical therapists, strength conditioning coaches, and sports nutritionists, and we work as part of a comprehensive program. Part of our role is also to provide psychological care for Purdue University athletics and Butler University athletics, where we provide weekly in-house counseling sports psychology services. So we'll be going through our slides here and kind of covering some background. Casey is in Indianapolis. I'm up at Purdue today in one of our consultation days, so we'll kind of move along. Briefly, my background, this is basically for now 28 years the field I've been working in as a counseling sports psychologist. My PhD is in counseling psychology, so I'm a licensed psychologist in Indiana and Michigan, but I did a minor in sports psychology and spent a year at the Olympic Training Center during my doctoral work, where I did my dissertation research on substance abuse education with athletes. And then I've worked primarily in collegiate settings. Washington State University was my first job about 25 years ago, where I was an in-house athletic department psychologist, including 5 years at Ohio State, and we're currently in our 15th year of consultation with Purdue University athletics. I've worked with Olympic sports and then currently professional teams in my 6th year with the Indiana Pacers as their team psychologist. In 2012, I was very fortunate and humbled to be invited as the first psychologist on the NCAA's Competitive Safeguards Committee, which is the sports medicine committee within the NCAA. And that position is now being filled by Dr. Jessica Moeller, who is a full-time member of that committee, which addresses student-athlete health care. And I always put on my bio, my daughter is a senior student athlete at Central Michigan University, and so that's a fun role for me as well.
Hi, this is Dr. Casey Oiness, and like Dr. Carr said, I just want to welcome you all and thank you for being here today. We're excited to get to spend some time talking about mental health in collegiate athletics. A little bit about my background and where I came from. I was a collegiate gymnast at Iowa State University and got the opportunity to compete there. And so sport has always been a big part of my life and a big part of what I do. Just like Dr. Carr, I did get a master's and PhD in counseling psychology and then specialized in sport and working within athletics. I was fortunate to get the experience of 3 years at the University of Oklahoma working full-time in their athletics department. And then I've been here at St. Vincent Sports Performance for the past about 2.5 years now. I know Chris had mentioned some of our consulting roles, and so I spend kind of my time divided between working with Purdue Athletics and Butler Athletics. I work as a consulting sports psychologist for the Indiana Fever, and then we also see athletes that range from middle school, high school age in our practice here in Indianapolis. So we work, very closely in athletics, both at the collegiate level and at other levels. So we're excited to be able to talk to you about mental health and athletics today. Just want to start by talking about what our goal is for today, and then I'll turn it back over to Chris. But really what we want to do today is provide a better understanding of mental health concerns that are evident in collegiate athletics, increase awareness on what are some of the signs and symptoms that you all can look out for in terms of recognition of mental health issues within your athletes. We're going to talk most specifically about anxiety and depression today. We want to provide you with some tools so that you feel equipped to provide support and resources when you do recognize some of these symptoms that might be occurring in your student athletes, and increase knowledge about what are some of the available resources in your area, at your school, so that when you feel like an athlete needs additional support or help, you feel educated on how to guide them in the right direction in order to gain that help with a licensed mental health professional. So wanting to cover a lot of material today, so we'll get going into that and leave some time at the end for questions. But I will turn it over to Chris to kind of start the conversation.
Thanks, Casey. About 1993 was my first engagement with the NCAA. I was currently, at that time, at Washington State University. Very first day of my first job after my PhD, the first coach on the very first day that I met introduced myself and said, "So you're our new shrink." And I said, "No, I'm your new stretch." This concern of psychological care for athletes has been ongoing for many, many years. However, it's really been in the past few years that there's been increased emphasis, focus, and more importantly, resources being provided for the collegiate student athlete. When I started on the NCAA Competitive Safeguards and Medical Aspects of Sport Committee, it was shortly after that in January of 2013 that Dr. Brian Hainline was hired as the Chief Medical Officer for the NCAA. And Brian came in initially kind of assessing concussion was obviously a very significant issue for the NCAA and its member institutions. But one of the comments he made, and I have quoted on the slide, is his awareness that student-athlete mental health was going to be a significant concern. And in November of 2013, he held a task force. I was one of 5 psychologists that was part of that task force to really identify the prevalence and the concerns related to student-athlete mental health care. You can go ahead to the next slide, Casey. We made a decision that for today's webinar, we would really focus more on identifying of specific issues and understanding resources than spending a lot of time on data regarding student-athlete mental health. We would really encourage attendees to access the NCAA Sports Science Institute as well as Drug-Free Sport in terms of looking for specific data. But this slide really highlights that as far as, as close to about 5 to 6 years ago, surveys done with managing student-athlete mental health 85% of athletic trainers indicated that anxiety disorders were currently an issue with student athletes on their campus. 83% of that same group indicated eating disorders and disordered eating, which could include body image issues, were a significant issue. And mood disorders, substance-related disorders, management and treatment issues, really taking care of mental health concerns, were listed as current issues. So obviously, data of athletic trainers, those folks that are in the front lines, that are in the trenches, are reporting there are mental health issues with our collegiate student athlete. We're not going to be able to adequately address, when you talk about mental health, all of the specific issues in sport. During the 5 years I was at Ohio State University as their athletic department sports psychologist, 95% of the student athletes that came in to meet with myself or my postdoctoral fellow indicated at the initial interview they were seeking performance psychology services. Yet less than 30% of our actual one-on-one care was performance counseling. The other 70% related to these types of issues that are being presented in the next few slides. So when we talk about mental health issues in sport, even though today we may focus on anxiety and mood disorders as a specific area, we are addressing issues such as substance use, abuse and dependence, disordered eating, body image and eating disorders, mood disorders, which are the major depressive disorder, bipolar disorder, anxiety disorders, which often are manifested in athletics as performance anxiety. As we'll talk about later, be very cautious of individuals claiming to treat performance anxiety that don't have the skill set or the appropriate credentialing or background to treat an anxiety issue. Adjustment disorders, which are pretty common for athletes making transitional stage development, so all of your incoming first-year student athletes often experience multiple emotional and cognitive changes. Homesickness, adjustment to not being the best, adjustment to losing, adjustment to not playing, as well as adjustment to the whole social, academic, and cultural shift. Comorbidity factors, factors that are coming in with a student athlete from high school into college, the whole realm of athletic injury and all of the resources that sports medicine and sports psychology can provide together, and that's, concussion is one of those. But in addition, we know there's some data out there indicating that a student athlete that is currently injured or requiring some type of medical care may be at a greater risk for a psychological issue to evolve, whether that be anxiety, mood, grief-related. And then we also know that those injured athletes, upon their return to play, without some good mental skills to help them manage their anxiety and their fear, are actually at potential greater risk for re-injury. Then anger management issues, stress management issues. Those are all related mental health components. And all of these components can be exacerbated by the stressors that are involved in collegiate sports. And so these stressors that we want to identify and just kind of talk about, many of you on this call, you see these every day, whether it's in your training room or in your academic settings or in your team room settings. But just stress doesn't necessarily have to be a bad thing either. Also understanding in stress research, positive stress, or what we call eustress, can have a physiologic impact on an individual as well as a cognitive impact. So it's not just distress, which is the negative stress, but it's also the positive stressors. But this changes the person's functioning at times. So we think about stressors in college sports being the transition, all of a sudden going from being the high school or the club sport star to now being in a very competitive, different developmental nature in the college level. The culture and climate of the athletics community, which is the fans, the boosters, the campus environment, the kid that's used to kind of walking through the halls of their high school and being very highly recognizable, oftentimes in a very enabling way. Now they go into a classroom in a college setting and potentially that athletic identity is not being embraced. And just the whole culture, which is unique to campuses from the Division I, Division II to Division III level. The whole concept of athletic identity factors and dealing with adversity and setback and how that may be stressful for the individual, the psychological aspects of athletics injuries, and obviously those of you watching say, wow, each one of these could be a separate webinar. And Casey and I, when we were putting this together, said, yeah, we're going to be bringing up topics and themes that by themselves are relevant. And I think psychology and athletic injury is a very significant area. That's why we feel, as part of our work, being very tied into the sports medicine team is important, even for the performance enhancement work that we do. And then the whole phrase of adjustment to the whole transition, adjustment to the whole process of new coaches, new teammates, new roommates, new living experiences, and being away from home. Increased media attention and exposure are other stressors that are engaged. The career development challenges, of course, working with professional athletes as long as I have. You know, the so few that actually make it to that next level are the so many when they come into college athletics, and their belief and focus that that's going to be their next stage. And at that point, they put other academic or career-based issues on the back burner, which when they become seniors and move into transitional stages becomes now a new stress. The relationship issues with coaches, and one of the things Casey and I really love about the work we do is spending time with coaches, individually as staffs or working with assistant coaches and professional development. That's part of our practice as well that we find very rewarding, because coaches want to know how to be effective in creating communication skills, being able to enhance the team component. But for the athletes, it's new relationships. And they often talk about the honeymoon phase from recruitment to actually being part of the team, and how that coaching behavior change can oftentimes be impactful. The whole competitive environment, dealing with losing, how do you manage that as an athlete where a lot of your identity is based on your record? The hidden or masked symptoms that are seen as desirable, such as aggression, which can be, as I've shared oftentimes when I was at Ohio State and would talk to our student athletes or to our coaches, the behavior that a player can engage in the middle of Ohio Stadium on the 30-yard line will get 100,000 people cheering. If he's 200 yards outside of the stadium in a parking lot, it will put him in jail. And how do we learn how to balance those kind of symptoms that are seen as desirable in athletics but in other factors are not? And then for every student athlete, and this is a catch-all, the individual differences and family of origin issues that these student athletes bring into their campus environment.
Thanks, Chris. So I'm going to transition into talking a little bit more about this stress. Chris obviously just covered a number of stressors that are a part of being a collegiate athlete, and some will impact some athletes, whereas others won't, and it's kind of those individual differences and helping athletes understand what their stressors are. But I think it's also important, like Chris mentioned, to educate our athletes on this idea of stress and that it's not always inherently bad. And so the Mind, Body, and Sport is a manual that the NCAA came out with that goes into a lot of great coverage on mental health issues, not just anxiety, depression, and mood disorders, but also eating disorders and substance use. So I encourage you guys to use that as a reference. But this quote comes from the Mind, Body, and Sport. Stress is not inherently bad. In fact, in many cases, it is a healthy part of growth. However, if it is chronic or inadequately managed, it can result in negative health outcomes either directly or through unhealthy coping strategies and behaviors. And so, again, I think the role we can play is educating our athletes about stress, and then also educating them about whether it's positive stress, negative stress, and then how to manage it. So when I talk to athletes and introduce this concept of stress, I think it's important to convey to them, what are some indications that the stress you're experiencing is negative versus what could indicate the stress you're experiencing is positive. So obviously this is not an exhaustive list, but some really easy things for them to connect with would be, how they experience the stress and what it feels like to them. So if they're feeling anxious or fearful, if they have a sense of dread, if they're wanting to really avoid something because it makes them feel apprehensive because they feel like there's danger or risk involved and it's inhibiting them, that tends to be more of that negative type of stress. Versus on the positive end, yes, I might feel some anxiety, but it's more of I'm excited about it. I'm motivated. I'm looking at this as an exciting opportunity. There might be risk involved, but I see that as an opportunity to challenge myself and see growth. I feel energized, and I want to approach that as opposed to avoid that. So that's more of that enhancing positive type of stress. That feels good, and that allows an athlete to continue to grow and develop and be successful. So again, I share this with them so that they understand that stress is not always bad. There can be a good positive side to it, but wanting them to be aware of how they're feeling so that then they know how to handle whatever type of stress they're experiencing. Some of the things that can cause more of the negative stress and anxiety and kind of sway it in that direction is when an athlete's feeling a lot of pressure, when there are a lot of expectations. And that can be pressure that's coming from external sources like parents and coaches and teammates, or that can be internal. Excuse me. What we see a lot of times with college athletes is that a lot of that pressure can feel internal, and that even if they have support and even if they have a good team atmosphere, they still might be putting a lot of pressure and expectations on themselves. And so wanting to kind of teach them how to shift that perspective and look at it a little bit differently. Another thing that can cause a lot of the negative stress is only focusing on the outcome. So only focusing on the outcome of a performance or the outcome of a test in academics or kind of anything in their life, focusing on the future or what's next as opposed to what's going on in the process. Even if the outcome didn't turn out the way that you wanted it to, do you feel good about the effort you put in? Do you feel good about how you performed in terms of process goals? And if they can focus a little bit more on that, that's going to reduce some of that negative stress and anxiety, because in that circumstance, they're focused on more what is within their control. Negative self-esteem, self-efficacy, if they don't believe that they have the tools to handle stress and they don't have the belief that they can cope with things, they're going to interpret stress in a lot more of a negative light as opposed to, okay, yes, I know I have all these stressors on my plate. I know I have school and sport and relationships, but in terms of self-efficacy, I believe that I have tools that I can manage that, and then they can look at it in more of that positive stress light. I mentioned before the lack of focus on what can be controlled. So again, that's focusing on external things, distractions, outcomes, things that they don't have control over. So helping them to touch back in with themselves about what is within their control. And then, of course, a lack of trust, and whether that's a lack of trust in themselves, their teammates, their coaches, a lack of trust in their abilities, any of that stuff can lead to the negative stress and cause them to feel that fear. So things to look for in terms of maybe when athletes aren't actually coping with stress very well, or when athletes are experiencing more of the negative stress. I like to provide actual things that you, in your role, whether it's as an athletic trainer or a coach or in academics, whatever your role is, things that you can look for in your athletes to indicate that there might be some difficulties going on. So behaviorally, you could see inconsistencies in performance. And so, you know, an athlete is performing well for a certain period of time, and then that kind of starts to fluctuate or go on and off. They perform well in practices, but then they go into a competition and their performance drops. That might indicate that they're putting that negative stress and pressure on themselves. Lack of clearly defined goals, differing levels of performance, like I mentioned, in practice versus competition. If you see your athletes experiencing a lot of nervousness prior to or during performances. So that might be someone who normally, you know, they behave one way and they're bubbly and energetic, and then all of a sudden another day you just see them being kind of withdrawn or introverted because they're so nervous, or their stomach is upset and they're kind of constantly making comments about how nervous they are. Focus is something that gets affected when athletes are experiencing high levels of stress. So an inability to stay engaged in a conversation, or them talking about, I'm having a hard time focusing in school or on the field or on the court. That might be an indicator that their stress levels or mental health is being affected. Difficulty controlling emotions. So again, all of these emotions are normal. It's normal for an athlete to feel anxiety, anger, frustration, disappointment. But if you notice an athlete is having a hard time controlling those things, that might be an indication that they're not coping very well. Negativity, and that can be directed at oneself or at others. Focusing on things that are not within their control. Lack of or decreases in motivation. So an athlete who maybe is usually a go-getter, they're proactive, they're always kind of wanting to push themselves. If you start to hear comments of, oh, I just don't even care, or I don't want to go to practice today. Again, I know some of these comments are normal, but if you're noticing them consistently, that might be an indication that they're becoming overwhelmed or overstressed. And then clinical signs and symptoms, which I'll talk about a little bit more, but that might be including sleep, appetite, changes in mood. And again, we'll go into what some of those clinical signs and symptoms might look for or might look like. Before we do that, again, I know Chris had mentioned we're not going to spend a lot of time on some of the research out there or the stats, but I just wanted to kind of put this one up as we go into talking a little bit more about anxiety and depression specifically. And again, this information is drawn from the Mind, Body, and Sport manual, and this information was generated from the American College Health Association. But when we look at the numbers in terms of feelings of depressed mood or feelings of anxiety, across the board, athletes and non-athletes, we see a lot of college students endorsing these signs and symptoms. You will see that athletics can provide a little bit of a protective factor, as you'll see the numbers for male and female student athletes is slightly lower than non-student athletes. But again, when we're talking about 21 to 33% feeling depressed, those are pretty high numbers. So obviously that's something that we want to pay attention to. I want to spend a minute talking again about more of the clinical signs and symptoms of anxiety and depression. And this, again, is not an exhaustive list. And, within the domain of anxiety disorders, within the domain of mood and depressive disorders, there are going to be different criteria that we look to. But I just wanted to highlight some of the common symptoms that if you're seeing these things that might be indicative of anxious or depressed mood or a mood disturbance, and an indicator that maybe they need to seek some professional treatment so that that can be further explored to determine what actual diagnosis they might be presenting with. But the common symptoms that we see with anxious and depressed mood are those kind of persistent changes in mood, so persistent sadness. Not just anxiety every now and then, but you're seeing someone kind of constantly present with anxious mood or excessive nervousness. Empty mood, so somebody feeling flat. So they may not say they're sad, they may not say they're depressed, they may just kind of say, I'm just kind of flat, I'm just kind of blah. There's not a lot of highs or lows, it's just kind of that empty mood. If you notice feelings of hopelessness, helplessness, worthlessness, if you hear athletes talking about, oh, it's not even worth it, or I don't even care, or it's never going to get better, those are signs that they may really be experiencing some clinical mood disturbances. Decreased interest or pleasure in things. So, athletes who at one point in time really loved kind of getting out there and doing things, or would get excited about going to dinner with the team, or whatever activity it might be, all of a sudden they're kind of disinterested. They're not taking pleasure in things that they once enjoyed. Decreased energy or fatigue. An athlete might start, just kind of consistently expressing, I'm always tired. I'm getting 8 hours of sleep, but I never feel rested. That might be a sign that that fatigue is stemming from some mood disturbances. Excessive worry and restlessness. I already mentioned trouble concentrating. Sleep and appetite changes, and those can go in both directions. It might be someone who, all of a sudden is sleeping hardly at all, They can't fall asleep at night. They can't stay asleep. Or it might be someone who's saying, oh, yeah, I could sleep all the time. You know, I'm taking extra naps even though I'm getting my 8 hours. And the same thing goes with appetite. For some athletes, they respond to mood disturbances with appetite increases. So yeah, I'm eating a lot more. I'm constantly wanting to eat. I can't control my eating. Or, you know, I just don't have an appetite anymore. I know I need to eat, but I just don't feel like it. So both of those can shift either direction. And irritability is another one I like to highlight because, again, sometimes depression might not present in the typical way that we would think in terms of sadness, but you know, an athlete might say, oh, I'm just getting so irritable. Little things that didn't usually bother me are bothering me, and you know, I can't control that feeling or that emotion. That might be a sign that they're not managing stress well, and that they're experiencing a greater mental health concern. I'm not going to run through all of these on the right, but in terms of what to look for with behavioral changes, missing or being late to practice or treatment, being tired all the time, changes in appetite, all of those things are things that you might be able to witness and observe in your role. Social isolation, so you know, that athlete usually comes in the training room and talks with everyone, and now they're just kind of sitting over in the corner getting their treatment done and then stepping out. And so pay attention to behaviors, but I would say with that, the thing I would highlight most is that you know your athletes best. So if you see a change in behavior and that change is persistent, that might be something that you want to check in with them about. I won't spend a lot of time here on crisis or self-harm because, like Chris said, any of these topics could be, you know, a whole webinar in and of themselves. But I do want to make sure that we at least touch on this because this is obviously something that can be a product of mood disturbances, anxiety, depression, bipolar disorder. You know, some of the things that if you're noticing on this list, that might be an indicator, okay, this person really needs some help and some support. So again, the things to highlight would be the feelings of worthlessness, hopelessness. If you're hearing that kind of stuff, just that giving up mentality, you know, that shows that that athlete is getting to a place where they're not feeling optimistic, they're not coping very well anymore. Isolation, when athletes are engaging in self-harm or having self-harming thoughts, oftentimes they just kind of want to be alone. They want to isolate because they don't want anyone else to know that that's going on. Hiding and covering up certain areas of the body. When we think about self-harm and possibly cutting, you know, if it's middle of the summer and athletes are wearing, you know, big baggy clothes or long sleeves, that doesn't necessarily mean that that's going on, but that in combination with some of these other symptoms might kind of be a red flag that they might be trying to hide or cover something up. So I think with all of this, the key for you all is if you're concerned, if you're worried, reach out to that athlete or reach out to someone that you feel could approach that athlete and make sure they're getting support. I think making sure that an assessment of self-harm and suicidal ideation occurs is key in these circumstances, and whether you feel comfortable doing that or not, finding someone that you feel you could connect them with that could do that assessment. And Chris will talk later about who you might be connected with on your campus that could help facilitate that process. So when to refer? So obviously, you know, there are a lot of different signs and symptoms, a lot of behaviors to look out for. But I think, you know, a lot of times the question I get from athletic trainers is, okay, when do I provide support? When do I, you know, ask questions, and when is it time for me to refer and make sure that they're getting connected to a professional? So I know I've mentioned a number of times that it's those persistent patterns that I would pay attention to. So if it's just, you know, a day and then they kind of go back to normal, it may have just been, you know, a normal stress response. But if you're noticing persistent patterns and changes, they're going to need a little bit more of an additional support system. If you start to notice a lot of conflict in interpersonal relationships, coaches are coming to you with concerns, teammates have concerns, you have concerns, and you're seeing it spread across the board, that's an indicator that, again, they're going to need some additional support and a referral source. If you have knowledge of previous mental health diagnoses, if they came in with a diagnosis of anxiety or depression and it felt like they had been coping okay, but then some of these behavioral changes start to occur. It might be indicative that that mental health diagnosis is recurring, or that they're not managing it as well anymore. Injury, disordered eating, grief, substance abuse. Again, those are all areas that warrant further discussion, and we don't have time for today. But those are all circumstances in which you might check in with the athlete, even if they're not showing, with injury, a response to it, a stress response. You might just say, hey, I know you're injured. I just want you to know that this resource is available to you for extra support. You don't have to go at this point in time, but I just want you to know that's available and that referral is there in case they want someone else to talk to. And then, of course, the mood changes and the self-harm I talked about before. One of the things, I really encourage those, like, pay attention to your gut, pay attention to what an athlete is pulling from you. If you feel like this is just outside the scope of my comfort level, outside the scope of my role, that's a good indication that when they're pulling that much from you, that they may be in need of additional resources, and a referral would be appropriate at that point in time. I am going to touch on a few of these and then turn it over to Chris so that we have time for him to talk about referrals. But I think the most important thing of approaching an athlete and what you can do to help, do it without judgment. Give the athlete some time to respond, because they may feel uncomfortable that people are noticing these things, even if they know that they need the help. And then just affirm that getting help is a sign of strength. Let them know that going to see someone or talk to someone about these things isn't a weakness. That doesn't mean that anything's wrong. It's a sign of strength to be able to ask for the help that they need. So I think if we can approach our athletes in that way, they're going to be more receptive to reaching out and gaining the support. So I'm going to turn it over to Chris now so he can talk about some of the relevant issues related to finding a referral and getting support and kind of the role of sports psychology.
Thanks, Casey. It's a lot of information to identify some of these symptoms and signs and behaviors that may be manifesting in the athletes that you treat and take care of. The context of this webinar is to help share some of those identified symptoms so you have that awareness. However, anytime Casey and I go out and work with coaches or in sports organizations, we understand there's a stigma about psychology and seeking psychological help care. It's changed, and very fortunately we're seeing a good change in terms of new positions, Division I primarily athletic institutions bringing on staff who are specially trained. But that stigma within your own setting, within your own campus or your own sports setting needs to be addressed. What we've noticed a change recently in the past 5 years is the increase of mental health assessment and screening in the PPEs, the pre-participation exams. And I know when I was at Ohio State, one of the things that I would try to do is be accessible on days of physicals, because just as radiology, cardiology, and other disciplines are available, you would often find that there'd be an athlete coming through the maze of first-time physicals and they were struggling. And so to be able to have that as a resource, and that was without a specific screening measure. The NCAA's Mind, Body, and Sport, and then their best practices in student-athlete mental health document that's just been published within the past few months have some potential screening devices that individuals could use. So I'd really reinforce and direct you to that. I think at the same time in our sports medicine care, I know Casey and I will do workshops with our athletic trainers, with our fellows, with our residents, with our physicians to help understand that when you are taking care of athletes and you are a care provider, you contribute to either the acceptance and breaking the stigma, or you contribute to the re-stigmatizing and pathologizing mental health issues. So professional development is important. And once there is an issue and once it's been identified, some campuses, the resources may be limited or difficult to access, and so there are some resources, there are kind of connections and programming that campuses, if they make this a specific decision to address, can take on and begin to create even in their situation, an optimal care model. And then I think it's this whole issue of sport versus clinical and counseling psychology. Just as a statement, someone calling themselves a sports psychologist, the questions you as a provider or a support staff need to ask is, number one, are you a licensed psychologist in the state? Because to my knowledge, all 50 states have specific laws regarding the practice of psychology, just like they do any other profession, physician, law, any other. And to call yourself a psychologist without a license in most states is against the law. The second conundrum one has is that if I am indeed a psychologist, what's my competency to do sports psychology work? Most states will also identify that licensed psychologists not practice outside of their area of competency, which is often based on training, education, and supervision. So I think as a care provider, it's important that you ask a person that's presenting themselves to you as a sports psychologist, A, are you licensed? B, if you are, what is your training and competency in the field of sports psychology? The whole dynamic and nature of sport is a challenging culture that people want to be in, and so misrepresentation, misguiding credentialing is an issue that you have to be attentive to as providers. And then once a person you have that may be a potential resource, what's their competency to train and work with clients, particularly student athletes that have these mental health conditions? And is this something that they've been supervised in? Is this something that they've had experience in? And I know just recently there was a Division I school that had hired their first full-time in-house athletic department psychologist. Within 8 months, they posted a position for a second full-time position because the demand and the utilization was so high. And that search had to be held because that department was being very clear about the competency and training and could not find an appropriately trained person. So I think that leads to this concept of, since we have a lack of training models, how do we get people to enhance their knowledge base about sport and the culture of sport? I would like to say that it's getting better, but just like all of our disciplines, strength and conditioning years ago, the coach did the weightlifting and you barely had a weight room. Years and years ago, coaches wrapped ankles. There wasn't an athletic trainer, and now we have sports medicine staffs. We have sports medicine settings, and we have large strength and conditioning facilities. So we're kind of, as psychologists and sports psych people, kind of learning to go through those pains at this point. And then I think the challenge on a lot of campuses is that teams or coaches will say, well, we have a sports psychologist that works with our team, oftentimes not realizing what they've really done is kind of hire a mental skills coach. And then you have the issue of compliance, and is this a accountable coach? Because if they're not a licensed provider, then in essence your compliance office would probably indicate that they are a coach, since they don't represent the care being provided those campus student athletes. And so a lot of our services we provide at Butler and Purdue, for example, and in my past, if the coach mandated the athletes attend a meeting that we were doing, whether it was a team building session or a mental skills training session or a stress management session, that was part of their 20 hours, and anything that was voluntary was not. But our role was always identified as part of the care team, sports medicine team, for those student athletes. And so you're oftentimes, the folks that are attending the seminar are in those positions where you're getting the marketing materials sent to you, and you need to be an aware consumer. This leads to the challenge for coaches. We got to get them better mentally. We have to get them to perform better. Dr. Jennifer Carter, who is the current director of sports psychology at Ohio State University in their sports medicine department that works with OSU athletics, continued the work. She was my last postdoc at Ohio State, and then she's continued, and in a 2005 study indicated 1 out of every 4 athletes that came to see them were just seeking performance enhancement only. In other words, 75% of the student athletes at this point coming in were seeking counseling. 52.8% of the work was clinical, 37.1% was combined clinical and performance enhancement, which means I may be treating a student athlete who has a adjustment issue, but we're working on mental skills to help them manage those emotional and cognitive demands that they are experiencing, as Casey talked about, giving them tools to manage those stressors. 90% of all treatment at that time was still being considered clinical care, which leads to this continuum. Dr. Nikki Moore, who's now the SWA at University of North Carolina in Chapel Hill. Nikki was the first full-time psychologist hired by Oklahoma's athletic department, and Nikki has now moved into athletics administration. She presented this continuum at the NCAA Gender Equity and Issues Forum in Chicago in 2010. What I like about this for educating with coaches and our sports medicine and academic services staff is that human beings operate on a continuum of psychological issues and care. And so as you look to the left, this is where a person has suicidal intent, they're at risk of harm to themselves or others, they're disassociative, they are really struggling, all the way to the other end of the continuum, which is optimal functioning. And what she's done is kind of underneath in the dark blue indicated the types of providers that may best care for the issues and where that person is at. I think this is helpful to understand that many student athletes never kind of fall to the left very often. However, if they do have some symptoms and their normal functioning is being disrupted, as a collegiate student athlete that has maybe 15 hours of semester classes, their training, their competition, their travel schedule, that slight disruption can lead to impaired performance in one of their domains, which then increases the likelihood of distress, and the functioning starts to dip even further. As she indicates, most of the people that are providing the majority of care have that training of counseling or licensure training, and the sports psychology consultant or the mental skills consultant can really focus on teaching things like team building, goal setting, and yet for those of us that are trained and licensed as providers, we're going to have a different skill set. So for example, Casey and I are counseling psychologists who have our sports psychology training so we can do the mental skills consultation, but at the same time we will have clinical resources including psychiatrists or psychiatric care facilities to use as resources for individuals that have more severe functioning. And that does happen in our work in college athletics. We want to really kind of, before we kind of wrap up, is say, understand when you make referrals or utilize a resource, make sure you know the qualifications. Do your diligence. Most of the positions that are being hired now at the Division I level are for licensed psychologists who have training and academic background in sports psychology. And what we're finding more and more is that athletic departments are hiring full-time people into these positions. What they're also finding is within 1 month of the hire, that person is on a wait list. When I came into Ohio State in 1995, there were 1,100 student athletes. There was one of me. It was difficult to meet the demand, so we had to create other resources, because imagine being the one athletic trainer or the one academic counselor or the only provider of care for a large number of student athletes, 400 to 500 at most institutions. And so one of the things that you have to understand is that there are full-time positions. There are also consulting positions, which may be a person that's in a private practice, a person who's in a hospital or sports medicine setting. And then that third position is a liaison psychologist for athletics from student counseling centers. Although we're not addressing this, student counseling centers, it's been a bit of a mixed review across the country about their acceptance of having a provider whose specialization is student athletes. And as I share and have shared with directors of counseling centers, these are students of your institution, and therefore should be given the appropriate resources that any student on campus may have. And yes, they do have specialized care, but at this point in the 2010s, we do not send athletes to the Student Health Center to get their ankles wrapped. We have in-house care, and it's particularly relevant that as we invest in the student-athlete experience in the athletic departments on our campuses, we want to address these issues that are coming along. So these are the types of referral sources that you need to be asking about. Casey and I get many emails, questions sent to us on a regular basis, and we're always glad to direct to people who may be local resources. We did want to leave, 10 minutes or so for questions. We know that folks may have specific areas that they want to ask about. So I think at this time, Laura will just kind of be available for any questions that are being sent in and answer those directly.
Great.
Having an opportunity to do this is just one of those unique pleasures where we sit and watch and say, boy, we could get more into this and more into this. And before you know it, the time is moving fast. So I'm glad you'll all have copies of the slides for your future reference.
Absolutely. No, thank you both. What an excellent presentation and overview of just, things to look out for and also what to do in terms of appropriate referrals. We do have a few questions that came in during the presentation. The first one is, what if you have an athlete that needs to be referred but does not go? Who should be making the decisions about participation and potentially return to play, or holding somebody from competition or practice, and or how do you get them to actually go and seek care?
I think that, it kind of can depend on, the system that you have in place. It can also depend on what they're being referred for. I know at Purdue and at Butler, we have like a treatment team approach, especially when there's an issue of eating disorders or substance abuse issues. And in those circumstances, the treatment team, that being Chris or I, the physicians, the sports medicine dietitian, athletic trainers, all work together to make that recommendation and just talk with the athlete about, the process, try to destigmatize it for them. So I always encourage, initially approaching it from providing the athlete with some more information, trying to normalize it for them and see if that, if they're willing to get to a place where they can kind of make that decision and go on their own. But I do know that in certain circumstances, especially if there's a health risk or, a substance problem, those are circumstances in which it can be mandated and required. And usually we kind of approach that from that treatment team model, and that coming from, like I said, sports medicine physicians in addition to us, and kind of using that team approach. Chris, anything that you want to add to that?
Yeah. What has happened and what I've observed in the past, 25, 26 years is that when you have positions in-house and you have really defined roles of counseling sports psychologists as part of the student-athlete care, then you're being more attentive to your mental health policies and procedures, and it becomes a very specific issue to address based in terms of behavioral referral. Even though an athlete would refuse, oh, I'm not going to go see my surgeon, my knee's fine. If an athletic trainer has concerns, there's symptoms that they're typically following and not likely going to give that student-athlete permission to return to play if they're not functional. And so what we want to do is we want to look at behavioral and emotional issues in the same way. When you have a resource that's part of the interdisciplinary team, it's so much easier to make that part of the process. I think what's harder is when you don't have that resource, you're using an external resource or maybe a system where it's difficult to obtain a release of information, it's difficult to get that consent for treatment. But at the same time, I think those kinds of issues are handled much better when you have an integrated care model.
Great. So you guys talk a lot about the interdisciplinary team, having multiple disciplines to kind of make those return to play decisions or participation decisions. What role does the coach play in that? Of course, I assume that they would be a part of that interdisciplinary team, or perhaps not. Can you expand upon that and what kind of communication strategies you might recommend to bring coaches into the mold and either apply these signs and symptoms that you've discussed today, or how do we get them to pay attention to the athlete's care?
Well, I know that this same presentation today we've given to coaching staffs at a number of institutions. I know that just a few weeks ago I was at a Division II school in Missouri working 3 hours just with their coaches about these types of issues. I think education is the first and foremost resource that you can provide to your coaches. Secondarily is that when you have, again, as a model evolves and you identify the resource, then that resource becomes accessible for individual coach consultation, that informal type of education about symptomology and how to best make the referral. In my experience, coaches can be some of the best support systems for those student athletes, particularly when they're having issues that are challenging from an emotional and behavioral perspective. I've brought coaches into interventions. I've communicated with coaches in terms of how to be supportive in their communication. And I think, to me, it's essential that coaches receive this type of education, but at the same time, even though they may label themselves psychologists, they're not psychologists. And I think that's a challenge that you have. And again, this is an issue that's even on a broader perspective about the liability of care for an athlete if they're referred to a person who isn't trained or licensed or doesn't meet the requirements to be the most appropriate care provider. So I think as we continue to educate and hold coaches accountable for all of their communication and their ability to support these student athletes, I think that's key.
Excellent. Just probably our final question here. But what advice do both of you have for smaller programs who, at this time, for example, high school or collegiate, may not have the right budget or resources available for a full-time sports psychologist, or even specialized in sports psychology to look for it, as you were both discussing?
Yeah, in smaller institutions, and we've done some work with D3 schools and smaller schools, what you do is you kind of assess your resource in your community and you start talking to folks that are out there providing. So your team physician or your head athletic trainer or your head of academic services goes out and has coffee with people in the community that are mental health providers to find out, A, is there an interest, availability, how can I access this as a resource? I think you have to be creative. Campus counseling centers are oftentimes great resources because their services are often either sliding fee or free for the student athlete because they're a student of the institution and they can be seen. It's oftentimes a matter of the providers of care may not have a really good understanding, and you can direct them to the NCAA Sports Science Institute and other providers that are out in the field. But I think once you realize that there are people in the community and you begin that dialogue and discussion and help them to be educated to the culture. Now be wary of the person that keeps coming to the equipment room all the time, or the one that's running to try to get tickets or wants to barter or trade out, because I would be concerned a little bit about professional ethics at that point. I think you can, within the purveyance of their practice, have that dialogue and discussion and begin to say, we want to identify who that best resource may be for our student athletes. Obviously, it will not have the same degree of sophistication or the same degree of deeper impact as a full-time or a more regular consulting sports psychologist, for sure.
And Chris, quickly, is there a resource available that these smaller programs can use, like a website that makes it easy for them to search for the right professionals in their area?
Well, there's really two professional organizations. One is Division 47 out of the American Psychological Association, and the website is apa47.org. And the second is the Association for Applied Sports Psychology, which is appliedsportspsych.org. Those are the two primary professional organizations for sports psychologists and individuals who practice in this field. There is such a thing as a certified consultant, but that does not mean that a person is licensed. What that means is a person has met some criteria to get the certification. It probably means they've had some decent academic training in the field of sports psychology, but that's about the only thing that's out there. I would really defer back to the NCAA sports science staff. They are in constant contact with campuses and universities. And, you know, for Casey and myself, you know, our email and resource would be glad to answer questions for anybody, and we're well connected to a community that's nationwide of licensed providers that work in the sports and sports settings, so we can be pretty regional. If someone has a question, we can find someone who's in their area.
Excellent. Well, that's all the time we have today. Thank you both so much for sharing your expertise with us today and answering our questions. Please accept an inaudible round of applause, I'm sure, from our attendees, who also thank you. And we hope to see how this process develops. I think it's a burgeoning horizon for athletics as well. So thank you both, and everyone have a terrific day.
Thank you.
Thank you.